Hi, this is Dr Aun Vishnar, and today in this lecture I will be talking about lower GI endoscopy, that is colonoscopy. By the end of this lecture, you will be able to recognize normal appearance of rectum and colon. You will able to recognize the various lesions in the colonoscopic procedure, and you will be able to classify the scheme of lesions and the action which is required by the endoscopist during the colonoscopic examination. Now there are wide range of pathologies that affect colon. So basic knowledge of these pathologies is required before making accurate diagnosis during colonoscopic examination. The endoscopist must provide structural evaluation of pathology, photographic image, and tissue histopathological diagnosis during the endoscopy. And if treatment is required during the procedure, give the treatment also. Furthermore, you will have to provide expert advice, expert opinion for further investigation and treatment based on the diagnosis. There is one technique known as chromoendoscopy, in which dye is sprayed over the lesion, and the sprayed lesion will become more clear, malignant lesion. So it will be easy to take biopsy from the lesion and to describe the lesion. Then one technique is narrowband imaging, with the help of which vascularity of lesion can be described in a proper way in video and photograph of the lesion. Chromoendoscopy and narrowband imaging are very helpful techniques. But apart from these tools, the main thing which helps in making diagnosis is experience. That is the eye of colonoscopist. That is the main judge in making the diagnosis. Now, whenever the lesion is present, it may vary from normal to pathological. So you will have to describe those lesions in the proper way. You will have to describe what is the site of, where is the site of lesion, where it is present, whether it is normal. If it is normal, why it is normal. If it is not normal, why it is not normal. So you will have to describe that in order to reach the diagnosis. Then what action you have taken during the colonoscopy for the lesion. Whenever you are describing the lesion, describe the site of lesion, what is the position of lesion, whether it is overlying or underlying the rectal fold, in the mucosa, what is its position in the colon, whether it is present in the 12 o'clock position, 6 o'clock, 7 o'clock, what is the position of the lesion, whether it is sessile or it is stalked, what is the size of the lesion, approximate size, and this is measured from the prongs, jaws of the forceps, approximate size. What about the surface of lesion, whether it is centrally depressed, it is irregular or regular, whether it is bleeding, shape, whether it is round or it is irregular, what is the shape of lesion, edge of lesion, whether edges are regular or irregular, whether it is mixing with mucosa or it is separate. Then fixity of the tissue you can assess with the help of forceps. Vascular pattern, whether it is bleeding or non-bleeding, in which anatomical plane the lesion is present, if ulcer is present, whether it is centrally depressed or it is covered with slough, So these are the elements which may help in describing the abnormal features seen in colon and rectum. So whenever you are doing colonoscopy, then first of all, before describing the lesion, you see the lumen. You describe the lumen, about the contents of lumen, whether it is empty or it is containing fecal matter or fluid or blood or altered blood, whether the lumen is normal in caliber or it is stenosed or it is dilated, is there any stricture, or if a stricture is present, whether stricture is regular, irregular, it is long, how long it is, whether it is bleeding or not. These endoscopic appearances give clue to benign and malignant lesions. The image shown in the lumen is significantly narrowed by circumferential tumors, which are covering whole of the circumference. So this should be properly seen in the colonoscopic examination. Then mucosa. What about mucosa in colonoscopy? Whether there is loss of or distortion of vascular pattern, there is erythema, hyperemia, it is congested, it is granular, it is friable, it is ulcerated, it is scarred, it is pallor, it is having petechial hemorrhages, erosions, pseudomembranes. What type of lesions are present over the mucosa? In case of inflammatory bowel disease, usually the inflammation is generalized. There is redness all over with no discernible vascular pattern. In flat lesions, if lesions are flat, you will have to see whether the flat lesion is adenoma, flat adenoma, or it is a flat dysplastic lesion, which is angioectasia or radiotherapy induced telangiectasia. The images shown in the area of telangiectasia, commonly they are referred to as angiodysplasias. Usually they are present in cecum in radiotherapy. Sometimes large area of tortuous blood vessels are visible and normal blood vessels are present adjacent to that. There is sometimes bleeding. So you will have to describe all these things when you prepare the report of colonoscopy. If lesion is protruding, it is not flat, it is protruding, whether it is a skin tag, it is polyp, it is pseudopolyp, it is lipoma, or it is some other tumor or mass, papilla, hemorrhoids, or condylomata, what is it? So in order to confirm, you will have to take histopathology biopsy from this region for the histopathology. If tumor is present or mass is present, what is the size of that mass, what is the site of the mass, whether it is fungated, it is ulcerated, it is infiltrative, it is frond-like, it is having prominent villus, it is obstructing the lumen, it is circumferential, or it is bleeding. If there is presence of ulcer, then you will have to describe about the size of ulcer, whether it is eroded, it is depressed, its margins are regular or irregular, whether there is any fistula associated with ulcer or fissure associated in the ulcer. What about the slough of ulcer? What is the color of the slough? Quantity of slough? If diverticular changes are present, you will have to describe it. You will have to describe the size of diverticula. You will have to describe about site of diverticula, single or multiple. You will have to describe about the complications of diverticula, that is whether there is perforation or not. So this is how you will have to describe these lesions. If polyps are present, then definitely polyps are of different types. So you will have to describe the polyps, whether it is pedunculated, it is sessile, whether it is hyperplastic, it is sessile, serrated lesion. So like this you will have to describe the polyps. If you are suspecting colorectal cancer, then appearance wise, whether it is polypoid cancer, it is plaque like cancer, it is annular cancer, or it is polypoid cancer. If ulcers are present, isolated ulcers or diffused ulceration. To report all these things, first of all, the bowel preparation must be excellent. Then only you can define all these lesions properly. I hope you will find my lecture beneficial. You decide whether it is beneficial or not. If you have any doubt, you can ask me. Thank you.